We'll begin by examining the room. Equipment used for head-to-toe assessment. Patient. Okay. Okay. My name is Kamisha Harris. This will be my Fall 2023 Head-to-Toe Assessment. We'll begin by assessing the patient's skin, including the head, neck, anterior, posterior chest, abdominal area, upper and lower extremities. The skin has no bruising, is warm, dry, and intact. There's no tinting with turgor. There are no lesions, no nevi, no scarring. Then we'll go forward by inspecting the hair and scalp. The hair is braided. The scalp has no redness, no tenderness, no infestations, no indentations, no masses, no tenderness. The hair is coarse, brown in color, and evenly distributed. Then we'll palpate the temporal arteries on each side. No tenderness noted. Then we'll go forward and palpate the lymph nodes. This will include the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Once we have palpated the lymph nodes, then we'll go to the TMJ. Here we're looking for crepitus, subluxation, or tenderness, none noted. Then we'll inspect and assess cranial nerve 5, which is her trigeminal nerve. We'll have the patient to clench her teeth, palpate the maxillary muscle, okay? And then we'll assess the sensory portion of the trigeminal nerve. So you'll close your eyes and let me know when you feel the kind swab. Okay? Then we'll assess cranial nerve 7, which is her facial nerve. We'll have the patient to smile, frown, pucker your lips, puff out your cheeks. Okay? Okay? Then we'll go to the eyes. We're going to inspect the eyes. The head is normal cephalic and symmetric. When we go to the eyes, we're inspecting the eyebrows, the palpebral fissure, and the eyelashes. The hair is evenly distributed. So we're going to inspect the eyes. The sclera is white, conjunctiva, pink, moist, and intact. There is no drainage noted. We're going to go to the ears. We're going to inspect the ears for shape and size, which are normal. We're going to palpate the pinnae and the tragus. We're looking for masses or tenderness. Then we're going to inspect the auditory canal. When inspecting the auditory canal, we're going to also look at the tympanic membrane. Just going to look into your ear, okay? Okay, we'll do both sides. Okay. Then we're going to assess for cranial nerve 8, which is her acoustic nerve. We'll perform 3 tests. One test will be the whisper test. So you'll just whisper the sequence of numbers. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. Then we'll do the Weaver test, assessing for lateralization. You'll feel vibration, okay? You know, I feel it. No longer feel it. Okay. Then we'll do the Renee test, assessing for air conduction being greater than bone conduction. You no longer feel it. No longer feel it. Feel it. Okay. So we've inspected the eyes. So now we're going to do assess for cranial nerve 2, 3, 4, and 6, which will be the optic, oculomotor, trochlear, and abducens. We'll be looking for gross visual acuity, peripheral, central vision, accommodation, conversions, EOMs. Okay, so I need you to take your glasses off for me. You'll cover one eye, read the smallest line. Okay, cover the other eye and read the smallest line. E. Uncover both and read the smallest line. E. Okay? And then, after that, I'm going to check for pupillary reaction. Okay, both eyes constrict, both pupils restrict, and I want you to just follow this item. Both eyes converge, then I want you to follow the item with your eyes. Okay? So we did that, and then I'm going to check her red reflex. Okay, do this one. Red reflex noted in both eyes with other internal structures. Then we'll inspect the nose. It is midline and symmetrical. So we're going to assess for cranial nerve 1, which is our olfactory nerve. We'll also assess for patency. So close your eyes and cover one there. Okay, and tell me what you smell. Okay, it is coffee. So cover the other there, keep your eyes closed. Tell me what you smell.
Sugar.
Okay, and it is a sugar candle. Okay, you can open your eyes. So we're going to palpate her frontal sinuses. No tenderness noted, and her maxillary sinus. No tenderness noted. So then we're going to go down to her mouth. Okay. We're going to inspect her mouth. Open wide for me. We're looking at her lips, her teeth, underneath her tongue, salivary glands, buccal mucosa, her posterior pharynx, and her tongue. Good. All are pink, moist, and intact. So then we're going to assess cranial nerve 9 and 10, being her glossopharyngeal and vagus nerve. So you're going to go her uvula and soft palate rise with phonation. We're going to assess for cranial nerve 12, which is your hypoglossal. So you'll stick your tongue out. Okay. Her tongue is intact, midline with diaphragm articulation. Okay, we did your mouth. Then we're going to go down to, we did your eyes, did your nose, did your mouth, did your ears. Going to go down to your throat. So we're assessing the tracheal. It is intact, swallow, to assess for the thyroid glands. Okay. Then we will palpate for carotid pulsation on both sides. Okay. Then we're going to listen to the carotid artery for any bruise. Okay. After we're done with that, we'll go down to the anterior and posterior chest area. So we'll begin by inspecting for any deformities. There are none. The anterior and posterior are symmetrical. The patient is not having any respiratory distress. There are no retractions, no accessory muscle use, no tachypnea, no cyanosis, no tripod positioning. Okay, so you'll turn around to the back for me so we can assess you from the back. Okay, so we've done our inspection. So now we are going to With palpate, there's no tenderness noted. So we're going to percuss over the regions. Then we're going to palpate for chest expansion. Take a deep breath for me. Okay. Then we're going to palpate for tactile firmitis. You'll say 99 each time you feel my hands, okay?
99, 99, 99, 99.
Okay, so we'll palpate, we percuss, and now we're going to auscultate. So first we're going to auscultate for your breath sounds. It'll just be normal. You just breathe in and out normal, okay? Starting up towards the scapula, in between the intercostal spaces. And we want to be sure to get the lateral lobe as well. Okay, then we're going to auscultate for egophony. So each time you feel me touch, you'll breathe in and out normal, and you'll elongate the letter E. E. Okay?
E. 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 E.
Then we'll auscultate for bronchophony. So you'll just say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay? Now we'll auscultate for whisper pectoralicoid. You'll whisper 99. 99. Okay? We've auscultated. Now you'll turn around for interior. We've already done our inspection, so now we'll palpate. So we're going to palpate for chest expansion. Breathe in and out. Okay, then we're going to palpate for tactile firmitis. You'll say 99.
99, 99, 99, 99.
Okay, so then we're going to auscultate the breath sounds from the front, just normal, in and out breathing, okay? Okay, we've done the chest. So now you'll lie down. With the head at a 30 to 45 degree angle. You need your chair to come next one. Okay, so we're going to inspect for jugular vein distension and pulsation. Okay, once we inspect it, then we'll palpate for any jugular vein distension, bruities, or pulsation. After that, we'll come down and we will palpate. We're inspecting for any heaves and lifts. Then we're going to palpate at the sites for any thrills or bruities. Okay. Then we're going to listen to the heart sounds using the bell and the diaphragm. So we'll listen for the aortic, pulmonic, at the second clavicular line, the herbs, the tricuspid, and the mitral, which is where you would locate your PMI and your apical rate. And the rhythm would be normal and the pulse is normal. Then we'll use the diaphragm and go back over your aortic, pulmonic, herbs, tricuspid, and mitral. Okay? So after we listen to the heart sounds, we've inspected for any heaves or lifts, we palpated for any thrills, and we have auscultated for the heart sounds using the bell and diaphragm. So then we'll come down to the abdomen. We're inspecting it. It is symmetrical, no contour is noted. We want to go ahead and auscultate for any bruise at the arteries. So we're going to auscultate at the renal artery, at the aorta, at the iliac artery, and the femoral artery. Okay. Then we'll go back over and we're going to auscultate the bowel sounds in each quadrant. Bowel sounds are normal, active, and audible. So then we'll go back and we'll percuss. We'll percuss over each quadrant. We're looking for tympany, flatness, dullness. And we can go back and we can palpate each quadrant looking for any masses or tenderness. Then we're going to also palpate for the liver. Then we'll palpate for the spleen. We'll have the patient sit up. While you're sitting up, we're going to palpate for CVA tenderness. Okay. You can turn. Okay, so we did the chest, we did the abdomen. You sit up. So then we're going to go into range of motion. Okay, so with our range of motion, I'm going to inspect the hands, the fingers, the wrist, the elbow, and the shoulder. There are no nodules, no redness, no crepitus, no tenderness. Everything is symmetrical. So we're going to begin with our range of motion. So with our fingers, we'll flex, extend, hyperextend, abduct, adduct, thumb opposition. We'll go to our wrist, we'll flex, extend, hyperextend, radial deviation, ulnar deviation, rotation. Our elbows, we'll flex, extend, hyperextend. Okay? With our shoulders, we'll flex, extend, hyperextend, abduction, adduction, circumduction. Okay? So that was our upper extremities. Then we're going to test our fingers for capillary refill on both sides, less than 3. And we're going to test for the radial pulse. It is normal. Okay? Then I want you to close your eyes. And we're going to assess for sensation of the upper extremities. Just let me know when you feel it.
Feel it, 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 feel it.
Okay? So then we're going to assess our strength. So give me your hand, just squeeze. Okay? With your brachial, you're just going to flex. Don't let me push down. Okay? Then you're going to do your triceps. You can extend. Let me get behind you. Okay? And after we've assessed our strengths, then we want to do our deep tendon reflexes. So you'll do the same thing with your brachial. All your arms up for me. Go to the other side. Okay, then we're going to do the brachioradialis. You can flex them out. We'll do your triceps at the same time. So brachioradialis, we're holding it here. Okay. Then your triceps, you're going to hold your arms like this. Okay, and you can rest them. So we did our deep tendon reflex for the upper extremities. We did our sensation. We did our range of motion. Then we're going to inspect the lower extremities. So at the lower extremities, we're looking at the toes, the ankles, the knees, and the hips. There are no nodules. Everything is symmetrical. No tenderness, no redness, no swelling. So we're going to begin by checking the capillary refill in the toe. It's less than 3. We're going to palpate the dorsal pedis pulse. Then we'll palpate the tibial pulse, the posterior tibial pulse. Okay? And then we'll assess for sensation in the lower extremity. So you'll close your eyes and let me know when you feel it. Okay, so then we're going to do our range of motion. So we're going to, with our toes, we're going to flex them. Extend them. Hyperextend them. Spread them out, abduction. Put them together, adduction. Then we'll do our ankles. For our ankles, we're going to dorsiflex. Do both, yep. Plantar flex. Inversion, eversion, and rotation. Yep. Then we'll go up to our knee. We're going to flex, extend, hyperextend, and then we'll do the other one. Flex, extend, hyperextend. Okay? So with our hip, we can do abduction. You can see, you can do it sit down. Yep. Abduction, adduction. Do the other one. Adduction, abduction. Okay? So we done our sensation. We did our range of motion. So then we're going to assess our deep tendon reflexes with our feet and our lower extremities. So we'll do the knee first. Relax your leg. Okay. We'll do this one. Okay. Then we're going to do our tibial. Our Achilles, I'm sorry, we'll do our Achilles. Then raise your feet up, we're gonna do the Babinski. Okay. All right. So we've done our range of motion, our sensation, and our deep tendon reflex, and now we want to test our strength. So first you're gonna dorsiflex, which is when you push up. Yep, don't let me push down. Then we're going to plantar flex, that's the opposite. Okay. Then we're going to flex. Just raise it up. Yep. Do this one. Then extend. Yep, raise it up. Yep. Do the other one. Okay, with your hip. You're going to abduct, bring it out. Don't let me push it back in. Okay, then abduct. No, you don't let me push it out. You gotta push it against resistance. Yep. Then we're gonna do this one. You're going to abduct, bring it out. And then adduct, bring it in. Okay, so we've done our range of motion, our sensation, our strength, and our range of motion, sensation, and strength. Okay, so now we're going to do our cerebral coordination before we stand, okay? So I want you to hold out both hands. Close your eyes. I'll place an object in each hand. This is called stereognosis. You tell me what you have.
Cotton ball. Pen cap.
Okay. Then I'm going to draw a letter in each hand. You tell me what you get.
L.
Okay. Open your eyes. We're going to do stereo opposition with our fingers. Put your thumb to each finger as fast as you can. Okay, then we'll do finger to finger. Okay, with your other hand. Okay, and then we're going to do hand flop as fast as you can. You got it. Then we're going to stand. Okay, so we could finish our range of motion with our hip. We had already did our adduction, abduction. So we can do our flex, which is the same as knee kind of flex, extend, hyperextend. We already did AD and AB. Then we do rotation, circumduction. Yep. We'll do the same with the other leg, flex, extend, hyperextend, rotation, circumduction. Yep. So then we'll turn to the side. I am going to examine your back. There's no curvature, no signs of scoliosis. Okay, so then we're going to exercise our lumbar spine. Okay, so I'm gonna get in front of you so you can follow me. Okay, so we're going to flex, extend, hyperextend, lateral flexion, rotation. Then we'll do our cervical spine. We're going to flex, extend, hyperextend, lateral flexion, rotation. Okay, then we're going to turn to the front. This is called the Rumberg test. You're going to close your eyes. The patient has no swaying. You open your eyes. You take about 3 steps forward. 1, 2, 3. Take about 3 steps backwards. 1, 2, 3. We're going to hop on each foot 3 times. 1, 2, 3. Other side. 1, 2, 3. Okay. This concludes my head to toe assessment for fall 2023.